And as more children dial into social media, a new study is shedding light on how it can negatively affect young users' mental skills years down the line. Researchers from the University of California, San Francisco, they found kids between 9 and 13 years old who increasingly use social media performed worse on reading, memory, and vocabulary tests 2 years later. Among children labeled high use, meaning those who spend 3 or more hours per day on social media, scores were 4 to 5 points lower on a 100-point exam. And it wasn't just the serial scrollers, even modest daily use was connected with lower cognitive scores. Joining us now to talk about this is Dr. Jason Nagata. He is a pediatrics professor at the University of California, San Francisco. He's also one of the lead researchers on this study. Dr. Nagata, thank you very much for joining us to talk about this. It is incredibly alarming for so many parents. First, why is there this connection that you found between social media use and lower performance on these tests?
Thanks for having me. We think that time spent scrolling often replaces time for reading, studying, or even resting the brain. And this constant stream of notifications and short videos or multitasking trains the brain to seek quick rewards, making it harder to sustain focus on longer or more demanding tasks.
So what can parents do about this? Because oftentimes it also feels like this is inevitable, like this is the world that we live in these days.
Yeah, the American Academy of Pediatrics advocates for a family media use plan, which is a set of rules that your entire household can follow. That can include screen-free time, so limiting screen use at bedtime or mealtime to promote sleep and purposeful eating. But I think it's also really important that parents model healthy screen habits. Our study actually showed that one of the biggest predictors of adolescent social media use is their parents' screen use. So it's really important for parents to practice what they preach.
And Dr. Nagata, as you heard us just mention, their Instagram says it will now limit content for teenagers based on PG-13 ratings. Do you see that as an effective way to protect these young users?
Well, I do think that our research has shown that adolescent users currently do have lots of exposure to alcohol, drugs, and other harmful content. And substance use is actually overwhelmingly shown in a positive light on social media. So I do think that, and our research has shown that these positive portrayals of alcohol and substances is linked with actually underage substance use. So I think it's a step in the right direction. Parents and clinicians can only do so much, and I think the most effective interventions have to come through the design of the technology.
Yeah, plenty of impressionable minds out there. Dr. Jason Nagata, thank you very much for joining us.
Thank you.